Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. Today, we interview a fantastic CIO CMIO team to talk about how they make it work. My name is Bill Russell, Healthcare CIO Coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. We have a few more channel sponsors who have chosen to invest in developing you and the industry through this channel. I'm going to highlight one for each new episode over the next couple of weeks. Starbridge Advisors is a firm that I'm excited to have joined us as a new sponsor. You ever think, I wish I could bring someone into our health system who has been there, done that, and is willing to come alongside my team and help them to be more effective? That's Starbridge Advisors. I find their distinctive to be that they want you and your team to take the victory lap, and they are willing to invest in people to make that happen. Starbridge Advisors provides interim leadership to expand your team's capacity in times of need. Visit Starbridge Advisors to connect with them today. Today, Tricia Julian and Dr. Brett Oliver join us for a great back and forth that covers collaboration, governance, and the value of a strong partnership to handle the ever-growing demands in clinical excellence in the markets that they serve. Here's the show. Hope you enjoy. Good morning, the two of you, and welcome to the show.
Good morning. Thanks for
Hi,
having me.
Bill. Yeah, thanks for having us.
You know, we had Dr. Bensema on, who used to be the CMIO and CIO. He was one person in both of your roles for Baptist Health. But I don't think I've ever asked him this question about the system. So can one of you sort of give us some background on Baptist Health, where you guys are at and what the system looks like?
Sure. We are an 8-hospital system across the state of Kentucky and into Indiana. We have about 2,100 licensed beds. We have all the continuum of care you can think of, from inpatient through employed physicians, home health, infusion services. We have a 9th hospital that we are in the midst of acquiring. In fact, there's a meeting about that today to set some final terms and agreements around that acquisition. And that will be another hospital in our Kentucky the Commonwealth of Kentucky. Brett, you want to add about the physician group perhaps?
Sure, yeah, we have employed physician providers of about 1,400 at this point. We have an ACO with about 48,000 lives, I believe, CIN. So yeah, as Tricia said, sort of a full gamut. We don't have any long-term care facilities that we employ, but we certainly work with them. But otherwise, kind of full gamut of care across the state of Kentucky and southern Indiana.
Yeah, it's pretty, and there's a lot going on in those markets. I know that CHI was in those markets. Is CHI still in your markets, or have they moved out at this point?
They are. They divested their Louisville properties and Louisville investments, but still in the eastern, southeastern parts of the state, it's still CHI or Common Spirit.
Common Spirit now. Yeah, so we'll see how that progresses. Well, you know, it's interesting. So today, what I'd like to do is cover an effective CMIO-CIO partnership. And I had the two of you on for this topic, not because, you know, you've raised your hands and said, hey, we're a good example of this, but because other people have said you're a good example of this. So, you know, no pressure on you guys to to sort of live up to that. But people have noted that you guys have worked really well together in the EHR implementation in terms of new initiatives and things that are going on. So I'd like to go down this path a little bit with you and just stay on that topic. And to start with, just to give us some background on both of you and how you got into your roles. Tricia, I'd like to start with you. Can you give us some background on how you got into the CIO role at Baptist?
Sure. So my exposure to IT really started in a banking career. Shortly after I graduated from Purdue University, I worked with Bank One in Lafayette. And so I was on the operations side, but Bank One was going through a lot of growth, and that growth required new technology implementations and also a lot of acquisition work. And so with acquisitions, you're thinking about migrating data, et cetera. And so I was actually selected from the operations team to serve on that, a multidisciplinary group, thinking about the technology and how we would make that technology available to our customers. And so after 5 years in banking, I transitioned to healthcare. I was again on the operations side of healthcare. And in my first career, with my first organization in healthcare, I rolled out 3 different technology solutions for transcription, dictation, and physician portals to get that information in the physician's hands back when paper charts were the norm of the day. And so what I learned through those experiences is I was coming at it from an operational perspective, but as I would interact with the IT team members, what they were surprised at was encountering someone from operations who seemed to understand that they just didn't have a magic wand to make all this technology work, and that sometimes operational leaders ask the impossible and yet didn't appreciate that they were asking the impossible. So in my career, then what I noticed was IT leaders were saying, if we have to do this project, we want Trish at the table. And operational leaders were saying, if we have to do this technology project, we want Trish at the table. And so through that, I actually led projects at different organizations towards the EHR transition. NextGen, Allscripts, and Epic were all systems that I had some responsibility to serve on in a leadership capacity to help deploy. And for NextGen, Allscripts, and Epic, in my early days with Epic, I've actually seen Epic 2 different times now. I got certified in those applications myself. So I'm feel comfortable on the application side and the operational side in terms of thinking about, from an IT perspective, how those technologies need to work in operations. The technical teams, I've just been blessed by being with really talented technical team members throughout my career who have taught me a lot about what they do. What does it mean to build an interface? How complicated is it? How do we break it down? How do we think about delivering the infrastructure, the networking, the Citrix, all the platforms? Again, that's not something that was a natural skill set for me, but I recognize that, and so I defer to those team members who, A, have that expertise, and B, passion, and just give them the opportunity to let that shine and deliver to the business needs.
So you've moved around a fair bit. I mean, you started in Lafayette, then you went to another health. Where's the health system you went to?
So I was in Lafayette, Indiana. I was with a group at the time. It was called Arnett Clinic. It's now part of IU Health. And then from Lafayette, I returned to Evansville, Indiana, which just happened to be the hometown for my husband and me after Jim finished his doctorate at Purdue. And I worked with a group there called Wellburn Clinic. And now that group is actually part of Deaconess Health System in Evansville. And then I moved to Corvallis, Oregon, and I served as Chief Operating Officer in Oregon. And it was really, and that role at Oregon was my first opportunity with Allscripts. There was a project underway, and as I was hired to serve as the COO there, it was made clear to me that I wouldn't have to roll out the technology. They had a project manager, and actually the medical director for the group was in charge of the project. But as it turned out, the medical director left within 2 months of my arrival. It's a big investment that you make for that sort of technology. So I partnered up with the IT team there, got to know that group pretty quickly, formed the team we needed, and we deployed Allscripts. And then from Corvallis, Oregon, how I came back to the Midwest, if you will, to the Kentucky area is, again, my extended family is in the Indiana area. So Baptist Health was looking to deploy Allscripts to its employed practices. So I had just done that again, but from the operations side. So I interviewed with a group of individuals and leaders here at Baptist to talk about that. Dave was actually on the interview panel. And he said what stood out to him was that I was coming at technology not from the IT side, but from the operations side. But I was hired at Baptist as the director of IT to deploy Allscripts to the practices here.
Yeah, and I spent a little extra time on your background because it's interesting when we talk about removing the gender barriers for getting to the CIO role. Because if you look at my show, and I interview a lot of CIOs, people say, hey, you interview an awful lot of guys. And I say, well, if you look at the CIO role, it's still like 10% are female and the remainder are male. And one of the things I like about your job progression is, and one of the things I tell people is, if you are open to moving, there will be more opportunities for you. Even if you end up back in your hometown, there's just more opportunities as you move around, because there's always a system hiring a CIO somewhere in the country, and there's, and someone with your experience was able to continue to move and move up the career path. So.
Oh, and then she got an MBA during our Epic implementation, Bill. The little night.
Oh, so the Epic implementation wasn't too much. You had extra time on your hands.
Thankfully, I was near the end of the program when Dave approached me to ask if I would serve as the executive director for the implementation. So I doubled up on classwork in the summer to finish it up so that but to Brett's point, we had to hire our Epic team, which consisted of about 140 analysts, and we had a full 3 weeks to get that done in order for Epic to commit to us that we could be on the platform by December 31st, 2016, which was really a drop dead date for Baptist Health. And so that was a pretty intense summer. I'm glad it's in the rear view.
So someone who came up saying, I recognize when people ask the impossible, you continue to ask the impossible from time to time.
That's right. That's right. But I'll get in there and do it with them.
So Brett, give us some of your background. How did you get into the CMIO role?
Yeah, sure. So it's certainly not a traditional one, although I've not met too many CMIOs that there is some kind of traditional pathway. I've been a family physician for 22 years, and as I was thinking through that, I've really run the gamut. I started off actually as an employed physician with Novant in Winston-Salem, North Carolina, when I got out of residency from the state of Kentucky. And when we moved back, I joined a private group practice, ended up starting a solo practice on my own, only to then bring others in for a small private group practice, ultimately to sell my practice to Baptist and become employed again. So I've kind of gone full gamut, seen quite a bit. It was 9 years ago that I sold my practice to Baptist, and at the time, Dave Bensma was, he led the physician group in our market. He was the physician executive in our market. So I negotiated my practice sale with Dave, and he ended up becoming a friend and a mentor, and we connected in some different leadership roles over the subsequent years. But honestly, Bill, I wasn't looking for a change. I like computers, but I don't have a computer science or computer background. And Dave came to me one day and said, I'd like to have dinner. I want to talk to you about something. I knew something was going on with the Epic piece, but I mean, maybe it was my naivety, but I really didn't know what he wanted to talk about. And he said, I asked me to be the medical director for the implementation, which, I was curious, like, okay, what's that about? We talked for about an hour about it. And then really the other shoe that fell was, I need 4 of your 5 days a week of practice. And, fortunately, my practice was set up where I had some new partners and they could absorb some of that change. But I really had to make the decision that if this doesn't work, I return to my practice and it's going to be an uphill battle of building that back. But I trusted Dave. I trusted his assessment of what he thought my skill set was and that how I could contribute to the team. And so I took on that role as medical director for Epic implementation. And then over the subsequent 2 years, it was clear Dave wasn't long for the job. Maybe it was because he had both roles for 2 years, but he retired in December 3 years ago and asked if I would be the CMIO. And kind of at the same time, Dave's a planner, and so this was not a surprise to Tricia and I that he wanted us to assume those 2 roles, and he had been grooming us in that way. And so it's been about 3 years since then, and it's fabulous. But I think the key, and I'm glad that we're talking together, because I think the key in me taking the role, and Trish and I even talked about this before they were formally offered to us, like, I don't know that I would want to do it with a different person and some of our other senior leaders. And so sometimes when people talk about what's your structure, what's your this or that, not just at Baptist, but other places, sometimes I'm not sure if it matters as much as the people that you're plugging in that structure. But anyway, that's a little bit about it. I still practice a day a week, which is getting tougher and tougher to do, but it's incredibly valuable in terms of what I can bring to the table.
So do you still consider Dave a friend, or do you feel like he pulled the wool over your eyes? I mean, he took you out. It looked like a nice dinner with friends, and then he put you in that role, and that's a tough role where you guys were at that time.
Yeah. No, he's definitely still a close friend and mentor of mine. We're at a good spot now that even when we're rolling out new hospitals, I don't have to wear the Kevlar anymore. I was coming to any physician meeting just tensed up, ready for a fight after going through what we did with the Epic implementation. And I do remember Dave saying something along the lines of, one of the risks that he took from a Baptist perspective is that at the end of this process that I would be valuable, I could go somewhere else and do the same thing, take another job somewhere else. And after going through it, I've told Tricia this, like, can you imagine going somewhere else and doing that again? Like, to get my head checked out.
There are people who are doing that. They're making a career of going from one system to the other. And if you want a list of systems that are still at the beginning of that journey, I can give you that list. And
that'd be great.
Yeah, that would be. I mean, every time I look at them, I'm going, man, you guys are at the start of a very. It's a difficult road, but it ends up being a lot better. At the end, you just have to go through it. So anyway, I want to get into the heart of this is the CIO CMIO relationship, how you guys work together, and it's really a tough act to follow. I mean, David Benzema was a one person in both roles, and the benefit of that is, he shares a brain with himself. So he's always on the same page with himself. He's strategically thinking about the organization the same way because it's one person, but in his mind, and now in the situation, the roles are split. Why do you think it's important to have two distinct roles, a CIO and a CMIO? It might be obvious, but I'd just like to talk about it a little bit.
As we now have exited the Epic deployment, what's interesting is there are so many demands for strategic thinking around our IT needs, and there is enough for what I need to consider and enough for what Brett needs to consider that it's definitely a full-time job for each of us. And so it's really reassuring to know, as it comes to matters relating to clinical needs or physician requirements, that the natural person to first think about that will be Brett. And Brett can let me think about, well, what are we going to do with the budget, and how are we staging our capital needs, and what are their timelines related to that. So I can be focused on that, and he can be focused on physician needs, for an example. But I really can't imagine. Dave did a wonderful job, but I will say to you what I think Dave also did, back to Brett's point about he was such a planner, that he had Brett serving as the medical director for the Epic project, and I served as the executive director. So I would see him even at times be able to delegate to us what may be more natural when we would transition to CIO and CMIO. He really started to help delegate some of those responsibilities to us so that the transition would be very just organic, honestly.
So is the split of the work pretty natural? Is it just, anything to do with clinical and medical starts with Brett, and anything that's sort of technology or digital related starts with Tricia? Is it pretty clear split?
I think there is some of that. Sometimes the clinical piece will determine it. We had a change in our reporting structure after Dave left, maybe a year after Dave left, where instead of Tricia as CIO, as CMIO, and then our CISO, we all reported to one particular person, and the organization went kind of a different direction, and that position no longer exists. And so now Tricia reports to our CFO. I report to our Chief Health Integration Officer, who's also in charge of our medical group. And then Michael Erickson, our CISO, reports to our Chief Legal Officer. And at first, I think we were a little concerned. We knew we communicated well with each other, but okay, all of a sudden we're not kind of coalescing with the same person in that reporting structure. But it's turned out to be really wonderful because we're getting glimpses of the organization from different angles. We have 3 of the direct reports to our CEO, of the 7 direct reports to our CEO, we interact with one-on-one and we report to, and then we have time with the majority of the other ones. And so I bring that up in your question about how we split up the work. Sometimes that just comes naturally. If the CFO has something that's kind of bubbling up, Tricia knows about it. She may not do all the work herself, but she knows about the work and the projects that are necessary. And kind of same thing from the medical group or the ACO that I'll hear. And of course, Michael with security and legal issues. So it does come a little more naturally, but I think it's not without some effort on our part in terms of we're very, very intentional about our communication with each other. I mean, we have our executive team meetings every week, but then we set aside time each month to round back with each other. There are plenty of times late in the day that I've taken up Trisha's evening as I commute about an hour when I come to the Louisville area. My practice isn't here, and I'll get on the phone and we'll debrief for an hour and a half, and I'll realize, it's 7 o'clock and she needs to go be with her family like I do. But that's a very important intentionality that I have that I don't think you see in a reporting structure, but it really makes this work.
Yeah, no, that's great. And I appreciate the long commute phone calls as well. I've been a part of those. So was it an easy transition for the staff? I mean, at one point I assume it was all under Dr. Benzema, but then it had to split out. So that's the nature of that question. Was the transition easy for them, or was it natural, or was there some challenges?
I think it's been a transition. There are always challenges when you're dealing with. We have 540.
Right around 500, actually.
Yeah. FTEs. And so, but Dave, again, as planning goes, he was extremely intentional during his years as CIO in that role to develop a teamwork. It was never about Dave. It was never about one person. It was always celebrating the team. He sent out emails every Friday that celebrated the performance of different applications, infrastructure teams, whatever, calling out the team members and really develop that sense of teamwork. And then I think as Trisha stepped into the CIO role, she's just continued this transparency where maybe IT was always not thought about in the organization. She makes it clear that we're at the table, that our current senior leadership, hears us. And when there are things that they would like to know about, whether they're interdepartmental or part of the system, she's articulating that quickly to them before a newsletter comes out or rumors can get started. I mean, there were times when she would send out something early on, and I'm looking at thinking, can she say that? Is everybody clear on that? And yet, of course, she could, but it was just being that clear and cascading that information broadly. So, I mean, and the other thing I'd like to mention too that we've established are these birthday meetings. So we've got 500 plus folks. You can't meet individually with all of them, and so Trisha established these birthday meetings. Why don't you tell them kind of what that's all about?
So, with the department of 500, I wanted to find a way to connect if the individuals wanted to just hear from the senior leadership. So Michael, Brett, and Michael, again, is our Chief Information Security Officer. The three of us set aside time once a month. If your birthday is that month, you're invited. Then invitation goes out. And essentially, we spend an hour, and they know up front. We've been doing it for it's about 18 months now into it that we've been holding this forum. And they know there's no set agenda. It's whatever questions you have, something that's on your mind, a concern that you have. We want to hear about it so that we can, give you the knowledge you need, the information, relieve any concerns or fears or anxieties that may exist. And we take detailed minutes from that meeting each month so that those go out. So if it's not your birthday, you still have the benefit of hearing what we were sharing. And the purpose of it is really, we have a strong philosophy of leadership within our IT team, and it carries naturally even from, there's been a lot of senior executive transition. So Brett and I were actually in our roles before. We have a new CEO now, we have a new COO. So those individuals came into their roles with Brett and I already as CIO, CMIO. So maybe to some of your question earlier, Bill, the transition wasn't even a transition for them. We were already in play. And so they naturally are looking at us as CMIO and CIO. But what we're saying to our staff, especially during periods of transition, especially at the senior most level of the organization, I recognize there could be fear, and we have been with them. I've been in the department going on 9 years now. So I'm not a new face to our team members. And I just wanted them to have the forum of safety, ask your questions. And so I think that helped, again, to your point about transition and how we're managing it and how we maintain a culture of openness. I think we all do better, right? I do better when I can understand what our senior executives need or what our customers need that we serve with technology. But my own employees are my customers, and I do better understanding what they need from me what sort of barriers I need to remove, what sort of back to sort of reality, what can we deliver and what is too much to ask in this given set of time based on competing priorities for tasks.
Yeah. Wow, the birthday meeting idea is wonderful. I mean, I hope as a result of this podcast, we start to hear about executives implementing that across the board. That is a phenomenal practical tip for people.
Hey, Bill, if I could add one thing. The other piece that we try to do in terms of the culture of the department is reminding them of the why of what we're doing, that, in terms of patient care. And I think that's something that we really try. It's something that I get to see whenever I'm in the office taking care of patients. I see an application, a BPA, some kind of med warning that's fired to help take care of the patient. But we try to, at a departmental level, recently, like I think just last week, our Floyd Hospital got reaccredited by the Commission on Cancer. And that came to the senior leaders. And Tricia was quick to send that out to our oncology support teams and anybody involved in making that happen, to remind them that this is why we do it. And, we've talked sometimes about, sort of mandating a day with someone in the clinical realm. But short of that, just trying to relay the why and showing them the stories that happen from real patient care, from the work that they're doing. And sometimes when you're sitting behind a desk or a cubicle, you might miss or forget.
Yeah, it's the health system I was at. We did a values in action at the end of every year, and 4 people were nominated in our 4 core values. And we showed the videos at an IT function. And I remember we got done, and I said, "Do you see who the best supporting actor is in all of these movies?" Because in all of them, you had technology was everywhere, and I think the other thing I saw that was really reinforced that was when Providence and St. Joseph Health came together. Providence brought with their culture that the IT staff was called caregivers. And I was like, I didn't know how I felt about that at first. And then I let that sort of sit with me for a while. And I realized, yeah, no, they are. They're providing care. They're easing the transitions of care. They're moving the information. These are all things that make the experience, the care experience, better for those people who are at that moment needing to be cared for. And part of that care is the technology working and working effectively. So it's interesting. Talk to me about strategy. So strategy is one of those areas where you guys could potentially fight. Brett, you might want more dollars, and Tricia, you might want more dollars, or you might think your project's more important than the other. So how does that work together? How do you guys work together on strategy?
Well, so one of the first things we do, as you well know, and you just described how you played a supportive role in many of your business's initiatives when you were CIO. That's true for us too. So first and foremost, IT doesn't form our strategy on our own. We have to understand what the business is going after. And then as we understand what the business strategy is, then we ask ourselves, okay, where will they need technology? How ready is our technology to support those initiatives? So some of what we've sought to do is Brett and I, with working with our leaders, and Michael's involved in this with his, the 3 of us are intentional about seeking to understand in what priority are those given business strategies. So what's the timeline for a given business strategy, and then backing into that, how much lead time are we going to need from a technology perspective to deliver to that? And that honestly is how we start to prioritize our funding within our budget. And while Michael's security budget is separate from the IT budget, we even still look at it holistically, because there are a lot of security initiatives that Michael, as the CISO, leads, but in order to carry them out, he needs members from my team to fulfill them. So we have to have that ongoing transparency. The collective 3 of us, the 3 chiefs in IT, have to appreciate what each other is being asked to do by their respective leaders, so that we position the staffing. Because oftentimes I would say if there's shared staff, it's mostly team members from my group coming to support what Brett may need or Michael may need. Do you think that's fair, Brett?
Yeah, no, absolutely. Yeah, I think our our organization has had a wonderful cultural shift over the last couple of years to want to include IT early. It's been the more traditional way of coming in after a deal is signed, a vendor selected, and the network doesn't work or something, but when IT gets notified that this project even exists. And the world that we're living in now is wonderful in that the vast majority of the time, the business leaders are asking the question, well, have you run this by security yet? Is IT involved? What can Epic do this? Or some existing platform that we already have. So that really helps our strategy become simplified, where if they'll just come to us with their business case problem, their business problem they're trying to solve, and then let us find the technology that we either have that just could be repurposed or a new vendor. And so our roles, kind of like as the work pops up in our different verticals, really are about keeping our head up for those new technologies that could assist in the strategy or business planning of the organization. So honestly, there's not a lot of infighting over, Michael gets special treatment with security, but otherwise there's no infighting with our budgetary wishes and desires, because they really come from outside of IT, if that makes a lot of sense. I advocate for things, and there are a few projects that probably wouldn't have happened if I wasn't advocating for them, but the most of it, we're supporting what the business is asking for.
Yeah, and you guys will have to pass along my apologies to Michael. It seems like it almost seems like the three of you work as sort of a triad of leaders that work very closely together. And if I had this conversation before, I would have naturally invited him, because I think it would be interesting to add that in, that component. It seems like you guys communicate. Are there areas where you guys end up co-presenting, that you sort of represent sort of both sides of technology and clinical, and you're co-presenting? Does that happen often, or special occasions kind of thing?
I was thinking, I don't think we've ever actually co-presented something. We do a lot of co-work on things for sure. Business continuity, disaster recovery, and there's clinical aspects and certainly operational aspects, but I don't know that we've ever co-presented anything. What's nice is that because of the way we communicate with each other, we oftentimes choose to go separate ways on projects or meetings, because we can cover more area, more territory. And I know what Tricia is going to say, and I know if something surprising comes up, she's going to let me know quickly, and vice versa. So honestly, I think it really helps, and that's another reason to have split the roles up. Back to one of our earlier questions, is we literally can be two places at once with the same mindset and understanding of things. But Tricia, I don't think we've ever co-presented anything.
No, like you, I couldn't think of a time where we have done that. You going to the governance examples, I think that's probably the best opportunity where I can think where Brett and I are serving on the same governance committee, for the perspective of they want to hear from Brett on the clinical technology aspect of it, and then they want to hear from me on deployment or budget, those sorts of things.
Yeah.
Well, speaking of governance, where do governance functions lie, and which ones, how do you split up that role within the organization?
So we have multiple governance committees that run here at Baptist. So ones where even our triad, the triad exists on the cyber governance. All three of us are on cyber governance. Brett and I serve on business continuity governance. I'm an executive sponsor of that with our COO, but Brett's a voting member of that committee. The triad will serve on a new committee that we're forming, which is informatics governance, because we each have unique perspectives around that area of informatics. And so Michael will represent his views on that, Brett his, and I'll have mine. Capital committee, I serve on that for our department. So when capital requests need to go through, if it's anything from our triad, I present it on our behalf, and I'm also a voting member on the capital committee. Brett, you want to talk about some of yours within BHMG and safety?
Yeah, I think I certainly been part of the system safety committee and our Epic governance councils, leading several of those. And but again, then just reporting back to our executive team, the initiatives that are coming, trying to get the medical group and those governance areas to think IT, to be thinking security, to be thinking dollars. The vendor says it's free, and like, okay, but there's some cost behind that. And even though I wouldn't be the budget expert or the security expert, just being able to be there to get someone to pause for a minute and think. And so I think that's all, amounts to how the culture is changing and really helping us along those lines.
How does innovation bubble up at BHSI, and then how do you sort of take something from an idea that could have a significant and positive impact on the community that you serve and make it a reality?
Well, unfortunately, we're not blessed with some $50 million innovation arm or sponsorship or partnership with Google or something like that, or maybe that wouldn't be such a good thing. But anyway, ours occurs more organically. For instance, 2 years ago, our physician cabinet, which consists of employed and affiliated physicians, had 2 goals for the year, and one of them was working on physician burnout. But the tagline was physician burnout and EHR optimization, like they were one and the same. So after my head dropped and I had a chance to articulate it's not just the EHR, that's when I start thinking about innovative things. And so I went to our director of training and support, and she and I worked through developing an Epic Mastery program, being very intentional with the word mastery, that this is a lifelong or career-long at least learning process with the EHR with technology, and developed a program to where each provider in our employed medical group at least will get touched twice a year, coming out, checking on them, using some reporting to help them along or to help identify some potential problems, but shadowing them and really just starting to develop a culture of this wasn't a one-shot deal. We're going to be here for you. Reach out to us, start keeping your list. But that at the time was innovative for us, but it grew out of an organic need. And that's kind of where I see things happen. I'll see innovation come, say, out of our human resources department when they're trying to address a problem. And then again, trying to turn to us for those potential technology solutions that could help. Not all are certainly going to be technology.
Yeah. As is usually the case, I put too many questions on a form for, I have like 10 more questions to ask you guys, but we're really out of time. It is really interesting. I mean, when things are really thought through and really set up correctly, and you have trust between the leadership teams, a lot of the things that you hear in other organizations, the politics of it, and some of the challenges, whatnot, sort of go away. I mean, you guys trust each other to attend different governance meetings, and you're going to communicate. You're going to bring things back. It really is. It's kind of interesting as I'm listening to this, because it's like it all sounds like common sense and simple, but it's not. It's not common, nor is it simple.
I would say it's a blessing to have Brett and Michael as my colleagues. They're trusted confidants. You have the chance to bounce something off them who do know technology well and can think through if this is going to make sense. And what more could I ask? They are just tremendous partners.
Yeah, it's fantastic. So, Tricia and Brett, thanks for coming on the show. I really enjoyed our time together. How can people follow you, or is there a way that they can, through social media or other ways?
I'm on LinkedIn, Bill. I'm also involved with the federal High Tech Committee as part of the CARES Act, and on some of the task force there, like USCDI, annual report work group, things like that. So you can check out that work. And I would encourage these listeners that I'm sure already do, but be paying attention for the next couple months when the final rules come down.
Yeah, it should be interesting.
And similarly, LinkedIn as well for me, but that's about it from a social media perspective.
Yeah, it's so you have a full-time job. Is that what you're telling us? I really want to thank Tricia and Brett for taking the time to join me on the show. They are such a great team. I'm glad I got a chance to share their story with you. Special thanks to our channel sponsors, VMware, Galen Healthcare, Starbridge Advisors, and ProTalent Advisors, for choosing to invest in developing the next generation of health leaders. Please come back every Friday for more great interviews with influencers, and don't forget, every Tuesday, we take a look at the news which is impacting health IT. This show is a production of This Week in Health IT. For more great content, you check out our website, thisweekhealth.com, or the YouTube channel. If you find the show valuable, there is one thing you can do to help support the show, and that is share it with a peer. Send an email to them right now with a link to the page and say, here's a show that I get a lot of value out of. Thanks for listening. That's all for now.